In this video, I'm going to show you how quickly you can create a progress note with ICANotes Plus. This patient is Teresa. She's coming back for a follow-up visit. She's been diagnosed with depression. She currently has symptoms of depression, and depression continues, and it's the same. There are crying spells, which are the same, guilt, which is worse, sleep problems are now present, and thinking difficulties are the same. Under behavior, her self-care is reduced, functioning at work is impaired, and she is having problems falling asleep. Under verbal content, she talked about problems with her marriage and with work, and there's grief, guilt, and shame. Under therapy intervention, your session goal was coping skills and self-esteem. Interventions were identifying triggers. You offered support, encouraged her to ventilate, and you counseled her on the importance of abstinence. One thing I want to note is this edit mode over here on the right. When I turn this on, you will see that the shrubs have changed in appearance. You are able to remove things that you may not use, and that will gray that out. You can also bring it back in if you wish to. And then you can also add your own custom content within the shrubs, as well as add custom buttons over here on the right. So you can customize this as much as you need to. I'm going to turn off edit mode and we'll move into the mental status exam. So her appearance was flat. She was disheveled and unhappy. Her speech and language were normal. Her mood was depressed based on facial expression and demeanor. Not psychotic, not suicidal, and denied homicidal ideas. You can also go into this as much as you like. And then you have a drug withdrawal and intox shrub. You can also record any rating scales. So here, if we did the PHQ-9, we can record that. Her score was a 12. It's going to say what the PHQ-9 is, what her score suggests, and we'll put in her exact score. Again, you can use the edit mode to add any other assessments that you may use that are not in our list. Current stressors, maybe problems at work. She has emotional problems. And then under problems in relationship, separation threatens. We do have a suicide and violence risk assessment here as well, and justify level of care and EMDR. And we'll move on to part 2 of the note. In this area here in the blue-green, your diagnosis will pull forward from note to note. If you need to change or add anything, you would simply click here, and we do recommend that you create a short list of the codes that you use most often in your settings. Also, the same with your service codes. Create that short list of codes here. We'll put that in there. You can also mark this as telehealth session. We can link to a treatment plan. Select your interventions. We'll link them. We'll say that there has been some progress, so we're going to continue the plan. And you do have an area to enter private notes. We can put in our follow-up. We want her to come back in a week, and then we will compile and preview. This is going to pull all that information into a nice narrative form, and you'll see that here. And to sign the note, we'll simply click this electronically sign button here, and your note is complete. You can copy and paste into another system, download, or print. And from this area here, you can generate an invoice. And that is how quickly you can create a note in ICANotes Plus.